Okay, everybody. Thank you for being here. I appreciate everybody coming. We have some information and clarifications we've been asking for from the state of New York that we got today. So we have lots of things to talk about. And so let's start out with this. As of right now, we have no deaths to report, but we have gotten clarification on data points related to nursing homes that now leads our death number in the community to be much higher. So the 19 deaths related to nursing homes related to New York State's reporting today, that was reported on earlier today, we've been asking for clarification to confirm that those numbers were in our numbers to date. And we are under the impression, we're waiting on final clarification now, but it's our belief that the 19 deaths that New York State has attributed to nursing homes are not in our number of 40 deaths in the community. We'll have final confirmation on that today, but certainly it is our belief now they are not. Earlier today it was reported from 17 deaths in Onondaga County to 19 deaths in nursing homes. We were not getting those 2 deaths reported to us. We've been asking for this clarification on defining a nursing home death. What does that mean? You live in the nursing home and you physically died there, or if you went to the hospital and the nursing home was your home, you died in the hospital, what that all meant. New York State updated a lot of that yesterday on their website. So it is our belief, unfortunately, that we have 60 individuals in our community that have died from COVID-19. Very frustrated by that, but want to certainly remember them and pay respects to them and their families. And it is our belief that those 19 individuals are not in our 41 count that we had going into today. After the information and some clarification. Again, we'll have final clarification on that tomorrow, but certainly it is our belief now that the 19 number of individuals that have died in nursing homes, that was not being attributed to the numbers we were receiving from the hospitals. So that is very, very sad. And so saying that, I can't share the demographics because I don't know who these 19 individuals were. We'll hopefully get the demographic information on them. But the only thing I know is that they're our neighbors, and I'm very sad about this. Related to testing, we have 14,746 tests that we've administered. This does not include essentially total tests done by New York State and nursing homes. New York State is doing testing in nursing homes right now. Our positives have been going up because of this and some of our proactive testing. We know that they're doing them in nursing homes. We're very happy with that. We've been asking for that. But they are not, we're getting the positives, but we're not getting the total number of tests from them right now. So we know that this number is a little bit higher when you look at those tests. But we've had 14,573 tests have been returned. 324 tests have been returned since yesterday. There have been 1,234 positive tests and 13,339 negative tests. We have 173 pending tests. And since yesterday's reporting, we've sent 239 tests to various labs from our community. 8.5% of these results have received a positive. This number is being skewed due to nursing homes. I think 2 reasons. 1, we don't have the negatives in nursing homes. And 2, we know that there is spread in nursing homes. So the percentage of tests that are happening in nursing homes have a much higher percentage than the 8% for the rest of the community. Since we began proactively testing in late April, we have tested over 1,600 individuals at assisted living facilities and independent living facilities for seniors. In coming weeks, we are expanding this proactive testing further in more independent living facilities, other strategic properties that we talked about where there's density throughout Onondaga County. That's going to be phase 1 of proactive testing. We talked yesterday about phase 2, getting into neighborhoods and incorporating essential workers through this part as well. Related to positive cases, we now have 1,234 cases. This is up from 1,178 yesterday, 56 new cases. We'll get into the breakout of that in a minute and talk about that story. Hospitalizations. We've talked about the fact that we have more cases in nursing homes. Some nursing homes are pushing clients to hospitals. This has not changed. I will give an update in a minute after these data on a call I had today where this is going to change. We now have 60 individuals in the hospital. This is up 9 from yesterday. Represents 11% of our active cases. Many of these new cases are related to folks who are being dropped off by nursing homes where these folks are asymptomatic and are not sick enough to be in a hospital. This has been an issue all week. We now have had a call, and I'll get into the details of that call and what we're doing moving forward. When we look at our critical folks, we have 14 neighbors who are in critical condition, up 2. This represents 3% of our active cases. Of some detail on those in the hospital right now. 15 are African American, 7 are of another race, and share their demographic information or declined. To date, we have 148 people that have been released from our hospitals. This is up 3 from yesterday. I had a phone call today with the nursing homes in the community. We have agreed to work together on a proactive employee testing strategy moving forward. We will be testing proactively the employees on a consistent rotating basis each month. In addition to that, we spoke about the reality of the fact that certain nursing homes are dropping off people at hospitals that are not sick or sick enough to be in a hospital. Asymptomatic positive patients or light symptomatic positive patients. We also talked about the reality that some of these facilities don't have the ability to have COVID units. So we are now garnering capacity, just like we do with our hospitals, with our nursing homes, on the nursing homes that have capacity to take COVID residents from other nursing homes into their nursing homes. And we're going to start organizing that with the nursing homes and our emergency management team so that these folks are not going into hospitals. They don't need to be in the hospitals. And in addition to that, we will be working with our hospitals when they have someone who is going into a nursing home that they are tested for COVID-19 before they're going into a nursing home. So when we think about how do we get cases in nursing homes, how did this happen when we had everybody essentially cutting off visitation from the beginning? This didn't happen in the first 4 or 5 weeks of this process. It has happened because we had either employees coming into the building that were potentially asymptomatic or light symptoms, and that led to spread, or you had individuals coming from a hospital that may have been asymptomatic or light symptoms that got sent to nursing homes for rehabilitation, and that led to spread. So we're now going to be testing both sides of that to make sure that moving forward, these things do not happen, or if they do, we know them and catch them quickly. So state is testing nursing homes, residents. We have been testing the employees. We now have a protocol where all the nursing homes are working with us related to proactive testing of employees moving forward. We are now working right now on capacity planning in various nursing homes that have capacity to take COVID patients from other nursing homes so they aren't going to hospitals. This is all news. These are all efforts that we're doing right now. So status on where we are, 1,234 positive cases, 532 active cases, 661 recoveries, up 29 recoveries from yesterday. Big recovery day, very happy about that. 175 individuals in our positive case are now household contacts, up 11. 26 of our new cases are affiliated with senior living facilities, essentially nursing homes out of that 26. So when we look at our 56, 37 of them are related to contacts, senior affiliations, 19 are community spread. Our 6-day running average of community spread is 19. So today's number of 19 is what our 6-day running average has been. There's certainly not as good as where we were a week ago, but certainly manageable numbers. Overall, out of our active cases, again, 2/3 essentially related to household contacts now and senior-related buildings. We now have 1,268 people in quarantine or isolation. When we look at our cases, our numbers related to where we've been, who's had the COVID-19, 707 females, 527 males. 39 of our cases have been under 19, 205 in their 20s, 154 in their 30s, 163 in their 40s, 200 in their 50s, 178 in their 60s, 130 in their 70s, 108 in their 80s, and 57 in their 90s. A percentage of breakdown: 20% are under 30, 32% are under 40, 45% are under 50, 62% are under 60, and 38% of our cases have been over 60 years of age. Related to total cases in municipalities, again, these caseloads are starting to be skewed by proactive testing and essentially buildings related to senior affiliations in these different municipalities. City of Syracuse, 644 total cases, 285 recoveries. Town of Clay, 105 cases, 74 recoveries. Town of Onondaga, 88 cases, 30 recoveries. Town of Manlius, 61 cases, 44 recoveries. Town of DeWitt, 59 cases, 35 recoveries. Town of Salina, 50 cases, 35 recoveries. Cicero, 44 cases, 30 recoveries. Camillus, 40 cases, 32 recoveries. Gaddis, 44 cases, 21 recoveries. Lysander, 30 cases, 20 recoveries. Pompey, 22 cases, 20 recoveries. Skinny Atlas, 15 cases, 13 recoveries. Van Buren, 10 cases, 3 recoveries. Lafayette, 4 cases, 3 recoveries. Marcellus, 5 cases, 4 recoveries. Atisco, 5 cases, 4 recoveries. Elbridge, what happened to my Lafayette? Oh, I said Lafayette. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. And Tully, 2 cases, 2 recoveries. One of the things that we've talked about, and I know everybody's talking about, physical distancing. Everybody knows the rules: 6 feet, within 6 feet, wearing a mask out into certainly retail establishments where we've seen cases. Our proactive testing is going to show that there's asymptomatic folks, especially asymptomatic cases in buildings where there's been essentially levels of spread. We're seeing that in assisted living facilities, certainly nursing homes. We'll probably see that in apartment complexes and other areas. Certainly, we're learning about what has happened in Madison County now with the greenhouse. And there's a lot of folks who live in Madison, Oneida, but we have Onondaga County residents there as well. Those positive cases, we're identifying them now. We know we have positives related to that. Those will fall under an affiliation category as well. But asymptomatic folks, we're finding them now, right? So we need to remember masks, physical distancing. That helps with folks that don't have what would otherwise be somewhat visible conditions or visible symptoms. So please, it's about protecting yourself, your family, and certainly your neighbors. Restart, we can go into any questions on that, but today, actually yesterday, we got data related to the economics of this virus and what does this mean for us as we start to get data representing the time frame where we've had the virus and we've essentially been shut down. So here is the data. Going into April, after Q1, we were at 4.7% growth on sales tax year over year. Q1, 4.7% growth. There was a period of time in Q1 where we were shut down. So essentially we had over 5% growth that brought us down. We received a payment, a sales tax payment representing the end of March and the first few weeks of April. That payment was off. Sales tax was down 27.6%. So the same payment we received last year was 27.6% larger than this year. That brought our year-to-date sales tax, which was at 4.7% growth, down to 3.6% negative growth during the year. So through the year right now, we're negative 3.6. The state of New York took $488,000 from us to pay villages municipal aid payments. If you factor that into growth, which you shouldn't, it's a one-time shot, but if you factor that into it, our receipts are now down negative 4.2% year over year. Remember, not this budget cycle, the previous budget cycle, the state of New York cut AIM for villages and towns, and they took that from county sales tax and city sales tax. So that payment of $578 used to be paid by the state of New York, but they pushed it onto the county and the city. So that brought our negative number to 4.2%. That's not a fair indication because that's not the economics of this. That's a one-time, they took money from us that we otherwise would have received. But if you were to then use that money into the payment, if you factored in that they took $488,000 out of our payment, that means that payment was actually minus 29.6% less, not 27.6% less than the year over year. So we didn't shut down our economy. The federal government, state government, local government all agreed the economy needed to be shut down through May 1st. Without helping us make up the revenue losses now, that is your definition of an unfunded mandate. The mandate, you shut down your economy. Because of that, businesses get hurt. The federal government has done addressing that through unemployment. They've been addressing that through PPP loans. What they have not addressed is the fact that some of the largest employers are governments, and that our revenues, we can now show you how bad it's going to be this payment and next payment. And moving forward, as things start a restart, it shows you how critical it is that we start a restart in a safe way, because our negative growth won't stop. It just won't be as bad. Once the restart happens, those payments won't be negative 27% anymore. They'll just be not very, very, very bad. They'll just be very, very bad. And then eventually, once we get the economy up and running, maybe we get those payments to level. Maybe we don't. But we can see how dire this is related to why we need help from our federal government. If we don't get help, we will have very bad decisions that we'll have to collectively be making in the month of June. So that's some economic data there. The access to assistance, again, the Upstate Triage Hotline, 315-464-3979. Call this line. They will screen you for testings. If you're sick, you have symptoms, then we'll get you to the triage testing site at the Syracuse Community Health Center to get you tested for COVID-19. Our seniors, our healthcare workers, and adult nutrition hotline, 315-218-1987. This is a line that we started at the beginning of this process. We knew there was going to be folks who needed help in ways they never needed help before. We've been really supplementing and complementing basic needs, meals, groceries, toiletries, toilet paper at times. So again, if you have a need and you can't get out and you need help, even if it's not something that we talk about, call this line. It will get back to us what that is, and we'll do our best to help you. Child Care Solutions, our continuity of care plan that helped our essential employees continue to go to work even when they had gaps in daycare. 315-446-1220. If you are an essential business employee right now, deemed essential, all employees are essential. Let me get that on the record. This is deemed essential by the Empire State Development Corporation. And you need help for daycare, your daycare falls apart, call 315-446-1220. And again, right now, as we look at the public health crisis, it's been about fighting COVID-19, preserving our medical infrastructure to help prevent unnecessary death. As we move into these other phases, mental health is as important as this. We have certainly the COVID-19 virus, but a symptom of this related to public health is mental health. And so we have this resource at 211. Please contact it if you need help. They'll help you with referrals, strategies for you and your family. Questions?
Brian, from the beginning, you and Governor Cuomo have talked about how important it is to have good data to fight this disease. How could it happen that there's now 19 deaths that were previously unreported? Is there a problem with communications between the state and the county, or what happened there?
I think certainly the communication with the state health department related to nursing homes has been problematic, and I think we now know information that we did not know, and I think we're a little surprised that we didn't know this information. Moving forward, I think as disappointed as we are that we found out this information the same way, really essentially, I think your outlet found out the information. The state of New York related to implementing proactive testing in these facilities has done what we've asked them to do, and they're our partners. And but I don't know how to say anything besides the fact that I found out that we lost 19 people in our community that I thought were in our 40 number, and now we're under the belief it's going to be confirmed tomorrow, but we're 99% sure that they were not in our 41 individuals we've been talking about.
So right now today, the state is reporting 46 deaths in Onondaga County, and 5 of those they have down as presumed COVID-related deaths in nursing homes. Is it possible that that's the difference?
We're trying to iron it out, Tim. Here's what I promise you and the public every time. If we're wrong about this tomorrow, that's a good day for me. I was wrong, but I don't believe we're wrong right now. And I don't know where they're getting that 46 number right now. So I want to be wrong. Hopefully what that data point you brought up is that, but everybody's been asking the question, and nursing homes are not our lane. We don't regulate them. So for the beginning part of this process, these facilities were working with the state health department. These facilities didn't need help in the beginning part of this process. The virus hadn't gotten into these facilities. We were very concerned about that, and we were taking very proactive measures to try to block that from happening. Now, what you're seeing is the virus has attacked these buildings, which is the worst case scenario. And so we've been you've been asking the questions on death. Does a death in a nursing home, if you have a death and is it a nursing home death if they died in the nursing home or the hospital? I would have thought that if that was my definition, I would have thought if someone dies in a hospital but they lived in a nursing home, they lived in a nursing home. So I guess that's related to a nursing home. We didn't have that definition throughout this process. I think Jim Mulder did an article where he asked us a couple of days ago. I think the number is 17. We were under the assumption that the 17 deaths in nursing homes were people that lived in nursing homes that died in the hospital or the nursing home, and they were in our 41. We now believe that that 17 is up to 19, and they were not in our 41 total. I hope I'm wrong, but I'm under the impression that I'm not wrong, so I'm going to talk to the public about it and report it. If I'm wrong tomorrow, we'll have a very happy retraction.
How did this clarification of data come about?
Through the health department put out some things. I believe the state health department put out some things on their website, and Dr. Gupta's had the specific conversations. And again, this is just, it is what it is. I don't, that's what it is.
So who brought that information to you, Dr. Gupta?
Correct.
And your response, your reaction to what I assume is the hardest news you've gotten through this process?
Yeah, look at these are 19 people. I had no clue we lost, and so I hope I'm wrong, but I don't think I'm wrong. I mean, this is what we understand to be true. So again, there's no perfect way in all of this, in our response to all of this. This certainly, I think, represents how bad the situation in nursing homes across the country is bad, and if this virus shows up. And so I'm not pointing fingers at anything other than the fact that I didn't know data, and I didn't know this happened. I believe this to be the facts on the ground today. I'm talking about it today, and if it's wrong, we'll retract it tomorrow. But we believe this to be the facts now, and until someone can confirm differences for us from the 41 to 46, to your point, Tim, until someone can tell us how they got to those numbers and explain it, we're going off of this information.
Does that mean the deaths up until now, the 41, were all in-hospital deaths, regardless of where they were before the hospital? 41 people died in the hospital, and now you have 19 people dying within the confines of a nursing home.
That's my understanding.
Ryan, you said you had a conference call with the nursing homes and that they're going to now regularly, proactively have their employees tested, and also patients that move from hospitals will be tested before they go into nursing homes?
Yeah, that was their request of us for the hospitals. We'll work with the hospitals and make sure that's lived up to.
Has that testing not occurred up until now? It seems.
Yeah, that would. I can't talk about every circumstance, Tim. I'm sure if the hospitals will say we've been doing that now, moving forward. And one of the things we've been saying is you can't, for example, elective surgeries. You're not going to do an elective surgery that's going to put someone in a nursing home right now. That's not going to happen. So I think maybe in the last 3 or 4 weeks, that's been happening. The nursing homes were telling us for a period of time that wasn't happening. So that needs to be the standard protocol. Before we're putting people back into nursing homes, the hospitals have the ability to do rapid testing, to get a result back in an hour or two. That's what you need to do for these types of individuals, and to make sure that they're not going to bring something into the nursing homes. We're going to do the proactive testing on a regular schedule with all the buildings, with our emergency management as part of our proactive testing program with the employees. And we're working on essentially a capacity study, just like we do with our hospitals, on nursing homes with the COVID units. So if you have a small nursing home that has a hard time isolating more than a couple patients who may get COVID, we'll get those other folks over to the COVID units, and that other nursing home might then take non-COVID folks coming over. So I'm very happy with the nursing home management and the call we had today. I was thrilled about the collaboration on what we're doing to make sure that we're not putting people in hospitals that don't need to be there, and how we're communicating and working together as a network and as a team moving forward. And then when we have the model, how this is going to work in Onondaga, we'll talk to Cayuga and Madison and Oswego and Cortland and make sure that we build this network for Central New York, because we have to get it right now, and we'll have to get it right moving forward into the fall in the event that this slows down and then pops back up at us.
I'm in touch with a nursing home that earlier this week was sending its COVID positive patients to hospitals, but now I assumed after your intervention they're sending them to other nursing homes. So has there been an improvement? Have some nursing homes been able to do lateral transfers where they hadn't when you first brought this to our attention?
They have. There's still a couple that have not stopped that practice yet. So that's going to stop, has to stop. And we're going to work as a team now. And everybody's working as a team with all the facilities. For the bigger ones that have the ability to have COVID units, that's what's going to happen. And they're going to work with our emergency management team to help coordinate this. Again, one of the best calls. I've had lots of calls throughout this process. This morning was one of the best calls I've had throughout this process with everybody, considering about how critical it is that this needs to get right. So everybody's working on a team moving forward in a way they never were before. So I'm confident about that, but at the same time, certainly, I had a hammer dropped on my head today too. So,
could you explain why it's so important to keep the nursing home patients that aren't severely ill out of the hospital? We have a big surplus of hospital beds now.
Because we never got impacted in the heat of COVID the way other regions did. Our margin of error on hospitalization rates for restart and continuing restart is smaller than it should be right now. So when you look at the metrics being used, look at it. We probably had 25 nursing home positive cases today. If every nursing home just goes and drops them off at the hospital, it's going to look like we have a huge spike in people who need hospital treatment, when the reality is that's not the case. So that then triggers potential pauses and slowdowns and inflates the data the wrong way. We need accurate data, to your point, Tim. So part of accurate data is people who need to be hospitalized need the beds, not people who are perfectly fine, just a facility doesn't want to have them in their building. So that's how critical this is. The metrics we're now held to for restart are probably too low compared to our hospital capacity. But those are the metrics, and we're meeting the metrics now. But if every asymptomatic or light symptom positive test gets dropped off at the hospital to be hospitalized, it's going to look like we're having a huge problem when we're not. And so that skews the data.
How many nursing homes have COVID-only facilities or wings or whatever?
I think we have 3 facilities right now that have COVID units. There's probably more room for some of these other facilities to have small COVID units. And we're going to work with them. We talked about PPE. We're going to work and make sure that everybody's got the right PPE and where there's gaps, helping them with that. We've been doing that. But now we need to be better. And so these units are almost like ICU units now, even though they're not on ventilators, right? So we have to be better, and it's almost like we're setting up small hospitals within these facilities. And some of them already have it. And we have larger ones. Loretto, fantastic facility that has the capacity really of a hospital. But moving forward, we have to do this, and we have to collaborate and coordinate as a region within the hospitals, which we've done. Now we're doing it in the nursing homes. We're doing it at the government level. So this is what we got to do as in a county and as a region.
The medical director at a nursing home suggested the need for a COVID-only nursing home where all the positive cases would go to one building. Do you see a need or possibility of that?
We may get there.
Are the residents that are being moved people who are just asymptomatic or have mild symptoms, and how is that range determined? And then if someone is being moved between different facilities, are family members being notified?
They should be being notified, yes. And so to the first part of your question, what's happened is some facilities, not all, are sending. You have in our hospital numbers, people are being released each day, and new people are coming into the hospital each day, legitimately. They're sick. They need to go to the hospital. many of those people are coming from nursing homes. So I'm not saying all the nursing homes are just sending non-sick individuals that don't need to be hospitalized. Many of them do, right? That's why, you know, you see hospital people get better, new ones come on. What I am saying is some of the buildings don't feel they're equipped to deal with COVID patients. Their answer to that, because they just got positives in the last few weeks, their answer to that is to send these people to the hospitals. Not acceptable. So we've communicated that, and we're now working to create where there's capacity in other facilities on COVID floors, send those folks over. And then if there isn't capacity with, and then if there's a facility that has a COVID unit and there's folks there that they want to expand that COVID unit and they need to send some of their residents to other facilities that don't have any COVID units, that's what we need to do. And so the families should be being notified. I know that they will be notified about that, and to help manage this situation and keep these people out of hospitals that are not sick enough to be in hospitals, we need this type of coordination. So the good news with all this is that coordination is happening. There's a commitment from our nursing home partners now to do that, and I felt really good about the situation earlier today after that meeting.
Are you able to say how many tests are being committed to senior living facilities?
How many what?
How many tests
Are being done where?
at senior living facilities? Because you mentioned
Difference. So we've done 1,600 tests at assisted living and independent living facilities. We control that. These are folks that we're going in. These are employees and residents. Actually, I think I got a positive number for Tim Knaus too on that. Tim, let me see if this is, I wrote it down, hold on. Out of our proactive testing, we've done about 1,600 assisted living and independent living. We've had 56 positives between the employees and residents there. We're trying to break out the asymptomatics of that. A lot of those are asymptomatic. The other positives, we just get the positives from nursing homes. I don't know how many negatives we have. So therefore, I don't know the percentage of people that are in nursing homes that get tested, test positive. That's data I wish I did know. My assumption, and I think it's an educated assumption, is there is a much higher percentage right now of people when they get COVID tested in nursing homes that are testing positive. That could be asymptomatic or symptomatic, but it's higher than 8%. I know that because that's what's driving my numbers.
I'm sure you've asked the state to give you those test numbers. Are they unable to, or?
We're waiting on that response.
There's a flaw with the state data that's being corrected today. The county's going to take a huge financial hit, and a lot of that are unfunded state mandates. Yet you see the governor getting national praise and being deemed by some a hero in his response. Do you think that's an over-characterization of how this state is truly doing?
This state has been hit the hardest out of any state in the country, and one could argue our state's been hit harder than many of the other countries themselves. So I think the governor has dealt with really an unprecedented crisis. And I've lived through what he has to live through with a much smaller population responsibility. His authority is 19 million people. You know, ours is essentially 500,000. We've been leading up the medical response for maybe 1.2 million with our hospital infrastructure. I think the governor's done, he's had to pivot every time things change, just like we've had to. I think the governor's done a good job. And I think the response has been there. They've done a good job letting us do our job in our lane, which is really important because we know our community and we know our lane. We want, when we see a challenge and it's not our lane, we want to help if we can, and we've wanted to help, specifically on nursing homes. Remember, I wanted to start this proactive testing a long time ago. And so overall, I think he's done a good job. And I think that for the most part, everybody's done a pretty good job related to this response. There's certainly things that we disagree with that all of our partners have done, and I'm sure there's things that they look at we've done and they're like, we're annoyed by what McMahon did too. That's part of this process, and the only way we get through this is by working together with the state and federal government. The federal government has a unique ability to help us right now related to the economic recovery. And if we're talking about economic recovery and you want us to keep our workforce whole, we need help. And only the president and Congress can do that. The state can't do that. How the state can be helpful is if they get help, don't pass on any more cuts to local governments, or else you just put me in a position where I can't keep my workforce intact again. So there's a lot of important decisions that nobody really wants to make. These, in 2019 or in February or January, I was fielding calls from all of you about traffic lights not working the right way, and some of these things that seem so obsolete now, but that's what we were dealing with. Those were the types of problems we were working on before because we were playing offense in so many ways. Now we're dealing with different phases of the unknown, preparing for a pandemic, the pandemic hitting, and there being absolute chaos essentially when it hits. Dealing with the crisis of trying to understand the virus, recognizing the economic ruin, preparing for restart, preparing for the second side of this public health crisis related to mental health and other public health issues we're going to have to deal with. And throughout all of this, decisions are made, and you have to pivot. And I think there'll be a lot of Monday morning quarterbacking going on at the end of this process. But right now, I'm not going to Monday morning quarterback anybody. I think everybody's done a pretty good job fighting this crisis. And how do I know that? Is because all of the initial models were wrong. And you can't attribute that to just being that these people didn't know what they were doing. They're very smart. And so what happened was the decisions that were made by the federal government, the state government, and the local governments had an impact on those models being wrong. So when you look at 10,000 decisions that everybody's had to make in this process, you're going to have some that you don't agree with, whether it's the federal level, state level, or local level.
That's very understanding, despite the news you were given today that your numbers were off by a third.
Yeah, well, I'm going to be understanding right now, and I'm disappointed about this reality, but I'm not going to finger point right now when, when you're playing a game, you don't execute your play every time down the court, down the field, but you can have a big play the next play to make up for it. So we got to continue. We're all on the team. We got to continue working together to execute, to get this community through this process. And then once we're done through the public health, economic ruin, then we all got to work together even more on recovery and preparation for what's next.
Given the outbreak at Great Empire Farm, I was just curious if the county has identified any other businesses within the county that they'd want to do proactive testing at?
We're going to work with business as part of proactive testing strategies. We have had there is no entity in the private sector in Onondaga County like what Madison County is dealing with right now. We have people that live in Onondaga County that work there. We've had positive cases. I'll know the number of that tomorrow, and those will go under my affiliated tab because these folks certainly that skews data when you have a outbreak like that, especially when you can contain the threat. So, but we've had nothing like that. That's a very bad situation that's happened in Madison County. And I think Oneida, Madison, the state health departments are working very well in keeping us briefed. We've been impacted far less than they have.
Ryan, when do we get the final word that we're a go in central New York for a first phase of restart, as of May 15th or whenever the date is?
I think it's when we have 7 days, our 7-day average hitting the testing number pre-May 15th. So that's what we're working on now. And we'll...
On the number of tests, not the
Yeah.
number of positive.
Yeah, number of tests. And so it'd be nice to know what the state's helping us out with this testing. They probably know those numbers and are adding it into our total. We just don't know it with nursing homes because they're doing them everywhere now. They're going through and doing them everywhere, which is fantastic. But we've talked to Cayuga, Oswego, Cortland, Madison about proactive testing. They need to be out proactively, strategically testing in their communities as well. We're helping them with test kits to do that. So we will have well over the 750 tests we need as a region per day by May 15th.
So it doesn't sound like we'll get much lead time to prepare and for people to get information about how phase 1 works.
We're having those conversations, Tim. To your point, I think there's going to be signaling to certain industries to get ready and certain communication. Certainly, we'd like those to. We would like those conversations to progress more, so that when we've talked about some of the things the governor's talked about, retail, curbside. What does that mean for furniture stores? Does that mean you can do appointment only, similar to auto dealers? These things, so these businesses can get ready, prepare. There's all these things that there needs to be more clarification in the private sector, more communication. But hopefully we'll get there. Hopefully there should be a recognition that Central New York is going to be ready. I'm telling everybody we're going to hit our numbers. We're going to hit our numbers. Trust me. We're not going to have testing averages holding our region back from restarting. That's going to happen. That's something we can control, and we will hit our numbers. So the state should be working on the assumption that Central is ready. 6 of 7 things we are ready on. The only thing is the testing average per day moving into it. We got clarification. That's how they're looking at us. We'll hit that number. So we're moving forward knowing we're going to hit all 7 metrics.
What was that conversation like with Dr. Gupta?
Yeah, look, these are never good conversations when we're going over data. We try to understand the data and understanding, and Dr. Gupta is very, very good about relating that this is all human beings. And her time as an actual practitioner or a doctor is really, really good in this time of thing. And Dr. Gupta brought up the point about, there's a level of dignity when she told me about these folks in homes, because I was upset, Andrew. And she brought the point to try to comfort me, I guess, that there's a level of dignity dying in your home. And this is home for these people. And so that was, I appreciated that, but that's the worst part about this. And we have other people in the community that are dying too on a day in and day out basis, not COVID related, and these families can't grieve together. And this is the worst part about all this. And it's hard for everybody else. And the economic hardship is horrible. And so we're all on the same team at the end of the day here. We're all on the same team. The common enemy is the virus. The virus has knocked us around at different times of this fight. And we've punched back, and we're punching back. And we're going to get our way of life back. We're going to fight it in real time. And then eventually we're going to get rid of the thing. And history will judge all the decisions we made. And if we made them fast enough, if they were the right decisions. But right now, everybody needs to understand there can be no partisanship at this point. This is all about teamwork and being on the same team.
Is it likely that there's nursing home residents who died in the hospital that are?
I believe so. Absolutely, I believe so.
So there's more than.
That's why you can see my frustration. I know there's people that went to the nursing homes, to the hospital, that died. I know there is. So I will have that. We're having that confirmed as well. But I believe out of our 41 that there are people that called nursing homes home their homes, they got sick, went to the hospital and died, and are counted in the 41. That's my assumption today. Again, if I'm wrong, I'll clarify that tomorrow.
As the regional leader, have you talked to another county executive or equivalent leadership since you found out that clarification? And does this skew the numbers that all the counties have been reporting?
Yeah, I think across the board, certain counties are going to have their numbers changed a little bit when they look at it. But not every county is coming out every day and reporting information the way we are, and being as transparent with the numbers. But look at from the get-go, I have very good friends in the Hudson Valley, and County Executive Steve Newhouse and Orange County, who's been, I mean, these communities have been hit hard, and nursing homes spread really quick in those communities. You knew that, so you're trying to do the proactive things. The problem is this isn't this is a bit out of our control. We don't regulate them, so we can't put local regulations on an entity that's regulated by a larger government. And so that's been a little frustrating throughout this, because these are my residents. But we knew that the threat was real. And so the only way that you can deal with it now, and you do the best, is you got to test everybody. The state's doing that. We've been asking them to do that. And you got to isolate everybody. You got to treat the sick and isolate the folks that aren't sick. And then hopefully there'll be a level of immunity built up that the second wave can't impact these buildings the same way. But we're going to be ready for it. And how? We're going to be testing everybody that works there on an ongoing, regular basis.
With regard to testing across the county, we now have sort of a unique situation where a whole bunch of people are showing up at the fairgrounds again for these drive-thrus, like the Pizza Free drive-thru. Have you given any consideration to the idea of potentially offering volunteer testing there as well while everyone's lined up?
No, and here's why. Because we need to know who they are, and we need to be able to register individuals to understand the data. There's two ways to hit these mandates. One is just, we're going to test anybody. We don't care. We're just going to test 14,000 people a month. It doesn't help me do my job if I don't know who's being tested, where you live. From a contact tracing standpoint, it's impossible. So we need to test many, many people in a coordinated fashion so we can isolate, trace, and quarantine. If we can't do that, we'll never effectively fight the virus. So we need to do this surgically. And you've heard me talk about, I love new labs coming into the community. They just got to play in the team. And they got to be part of the team because I need the data, or else I can't make decisions. And so the random spots, it's a good, when people are starting to do testing, antibody testing, Dr. Gupta talked about this at one point. People want to hear about this. They want to say, geez, is there a way I'm immune to this? That helps deal with their fear. We don't know if you are immune or not immune right now yet with antibody testing. Some of you are, some of you aren't. But from testing numbers, the same thing. We're testing all these people. If we don't know who you are, we can't track it, we can't understand it, we can't trace it. And so we'll find out a positive. We'll find out a positive too late. They've been in the community for another week. We have to go trace. Did we miss anybody in tracing? It all has to be coordinated. So we need the testing to be coordinated. And that's why we need to kind of control and have a level of control over that process.
Are you concerned then about the new locations that are coming into test, the new urgent care centers and so on?
Yeah, I am concerned about the tracking and tracing, and I'm concerned that I can't use their data unless I have it to meet our mandates. So that means we're going to have to do, if they're not going to share the data, it won't be as effective for the community's fight against the infection. So if they do share it, then they're part of it. They're sharing. We know who the people are. We can quickly isolate, track, and quarantine. And then I know the numbers. So then I don't need to go do 200 or 300 more a week because I know that this business is doing that. So we got a mandate. We got to hit a number of tests. And we have our mandate that we have to hit related to tracking the positive cases and the contacts. So we got to do that in a coordinated way.
And that data, again, is impossible to get from the state database?
We won't get it in real time. That's for sure.
Do they have the option to not share the data?
Well, again, they get set up and they get their approvals through the state health department, right? But the state health department doesn't have the tracers and the people working on the ground doing this. They're a regulatory agency. So they give out the approvals. So they give the data to the state, and the state will report it at some point, but it's not real time. If I want to stop the spread, I need the data now, right? And so that's the challenge. That's the challenge.
Is that true with rabies data, flu data, that it just, even through these outlets, it just doesn't come to you in real time?
I don't know the answer to that because I've never looked into it, but that's my assumption probably, right? And it's tough. I mean, the whole state department trying to get real-time data, this or there. That's why the locals are the ones doing most of the work on the ground. That's the bottoms-up approach is always better. Other questions?
Assuming we do restart sometime soon, what would be the key metric that the state is going to watch to determine whether we've overheated with virus and need to pause again? Is it that rate of transmission? Is it hospitalizations?
I would think it would be hospitalizations, and I think we got to get, especially when you're looking at once you get into restart. I think you need to understand the hospitalization story better. Everybody's got to be able to. There's got to be some flexibility there. What did you see? Was there? Is it an isolated situation? Did a nursing home just dump off 20 people who are COVID positive at your front door? I mean, these are things I didn't think about 4 days ago. Trust me. And so, but I think it's all about your ability to treat sick people in a timely way to limit death. And so I would say hospitalizations, certainly if you get an infection rate of all of a sudden you have 4,000, 5,000 active cases within a short period of time, you're going to see the hospitalizations rates drive significantly. So those two are kind of correlated. Yeah, I mean, if we're doing 14,000 proactive tests, you're gonna find all the asymptomatics. It's gonna happen, and you're gonna certainly have lots of new positive cases. That's the way it's gonna work. So it's really the hospitalization. So if you're finding a lot of asymptomatics, they won't ever get to the hospital. So I think it's really the hospitalization number.
How many of the asymptomatic patients are technically pre-symptomatic and then begin showing symptoms after you get the test results?
Yeah, so we would look, so asymptomatic's got to be they didn't have symptoms, they test positive, and then they don't have symptoms. That's kind of what we would consider asymptomatic. So if they're asymptomatic, then they turn into having symptoms, then they would fall into the symptomatic category. And that's really why you have the quarantine period. So really, there are people that have no symptoms that have the virus and don't ever develop symptoms. And that's a lot of the positives that we're finding in some of these facilities now. And why are they in those facilities? Because the virus was there. We already had levels of spread in those buildings. So not everybody got it and got very sick. Some people got it and you never would have known. Any other questions?
I'm just trying to look up Oneida County. He does a daily briefing, Anthony Picente, just like you do. On that same data where it talks about the new nursing home data, it lists 9 and 9, 18 for Oneida County. Could their number jump 18 more deaths like what happened in Onondaga County today once they add that math up?
I don't want to speculate as to theirs. I don't know, but if my good friend Tony Picente, who I talked to I talked to Tony today. It was before all this. If he didn't, I don't know. It could. I hope not for him. I hope not. But It could.
And that just comes down to the state health department communicating with the county health departments previously.
They reported it, essentially. We've been asking for clarification on the numbers. They reported it, I think, last night on their website by county. And then
saying here are the numbers.
here's how many
but
nursing
they
home
died
deaths
within
you've had.
the facility.
Correct.
This is not counting outside.
That's our understanding. Other questions? Okay, here's the deal. Mother's Day weekend, do not blow it. Okay, don't blow it for mom. Don't blow it for a significant other. I've had experience in this. It's not pretty. So make sure today to get the goodies, get the flowers, a nice card, a thoughtful card will be important to this. All the moms deserve it. So my advice to all the children and all the spouses of mothers, do not blow it. You've been warned. Be safe.